My name is Michelle Tracy. Like I said at the beginning of the video, I am a migraine patient advocate, or I try to advocate for the entire headache disorders community. So clusters, new daily persistent headache, migraine, all of them are things that I'm really passionate about learning about, writing about, talking about, and helping people really understand what these diseases are about and why we need more research and more support and more funding. And the American Migraine Foundation has been a really big part of that for me, because I've been able to work with them and get an amazing amount of information from them. And being in the Facebook group has just been wonderful. So I'm excited to talk with you sort of about how I got to this point where I am right now. And so basically, I was diagnosed with chronic migraine disease when I was 19 years old. So that's 14 years ago, actually, this August. And I sort of thought that my migraines were chronic pretty much from the get-go. But then I realized that when I go back and tell some stories from high school, they often involve me having a headache and feeling sick to my stomach. So I think I might have had milder migraine attacks then that just sort of kicked into high gear in my sophomore year in college. So what happened on the night that I had the first migraine attack, I remember it well. I had really severe head pain. I was really nauseous and vomiting. Apologies if anybody's eating while I am chatting with you guys, but you guys know all the symptoms, and my parents and I were pretty freaked out about it. And so we went to the emergency room because we weren't sure what was happening. And, you know, a lot of us in the back of our minds when we first have that severe migraine pain is that we think it's going to be some kind of brain aneurysm or something because it's such an intense pain. Oh, hi, Mom. Mom's watching. So, and she and my dad are two of my greatest supporters and biggest advocates. So I have really incredible support from my mom and my dad and my brother. So that's really great for me. And that'll be sort of the next part of my story. But so we went to the emergency room, the local emergency room, and they did the tests that they do to make sure it's not meningitis and to make sure it's not this or that. And the doctor said that I had probably just had a really severe migraine attack. So they gave me some pain medication, some anti-inflammatory medication, nausea medication, and antihistamine, and got me feeling better. And then that doctor suggested that I see a neurologist, which is kind of, at that time, was kind of unusual. I came to find out later on that this particular doctor, who is one of the most amazing doctors I've ever met, and he was an emergency room doctor, had personal experience within his family about migraine disease. So he was able to get me hooked up with a local neurologist, and I'm pretty sure that that's actually contributed to, you know, how I've learned to advocate for myself and things like that, because right from the get-go, he didn't just sort of throw me off like, it's just a migraine, get out of my ER. It was like, let's get you feeling better, and now, you know, here are some steps that you can take. And I know that we've all had, or many of us have had unfortunate experiences in the ER, but this particular doctor, a shout out to Dr. Sharuto and Nurse Rin, if either of you guys are watching. They sort of started my journey off right. They were amazing. And so after that, I seemed to be getting migraine attacks several times a week, which eventually went to several times a day, which eventually went to every day, and then all day, every day. So I arrived at a point where my diagnosis was chronic intractable daily migraine, which basically means for me that I had a migraine all day, every day, and it was very difficult to treat. So I've seen a handful of neurologists in my time, and the real difference for me was when I started to see a certified headache specialist. And initially, I wasn't really sure how important that was, and I thought there's a neurologist right in the next town over. I'll just go to him. And I was told over and over and over again, there's nothing else that we can do for you. In fact, there's nothing else that can be done for you. You're just going to have to learn to live with the pain. And my parents and I were not okay with that being the answer. As a teenager, being told, well, when you go through menopause, they might go away, which is not even really necessarily true. But at 19 years old, I wasn't thinking about menopause. And so we went to some different doctors, and I actually got a really important piece of advice from Terry Robert, who is another migraine advocate. And she's also one of the mods admins for the Move Against Migraine Facebook group. And my brother's here. Hi, Michael. And so what Terry said to me was, you can fire your doctor. I said, what? She said, if your doctor is not doing what you need them to do and is telling you the kinds of things that your doctor is telling you, that nothing else can be done, that no one can do anything else for you, live with the pain. Terry said, fire that doctor. Keep going to doctors until you find one who is willing to work with you. So I fired that doctor, and I went on and on and on, and I eventually was able to find a doctor in June of 2015. So for those of you playing along at home, that was, almost a decade basically after I had started getting migraine attacks. I put out a desperate plea on Facebook. I said, I live in Massachusetts. I'm willing to travel. I need a good neurologist that is preferably also a headache specialist. Quick shout out, because I see Judith's here. Judith is joining us from Australia, which is what I mentioned before. I said that there might be some international folks joining us. So yes, in June, I put out this plea on Facebook saying I'm in Massachusetts. I need to find a certified headache specialist, somebody who really gets it, who knows what's going on. And interestingly, it was cluster headache patients who messaged me and who responded. And they said, if you live in Massachusetts, you need to get yourself to Dr. Brian McGeeney's office. So I made an appointment with him, and I was able to get in to see him. And that was really a large changing point in my story. Dr. McGeeney has been a huge asset to what I refer to as my dream team. And I'm going to take a minute now to answer a question that I've received a lot, which is people ask, what do I mean when I say my dream team? Or how do I get a dream team? Or who's on that? So for me, what my dream team consists of is Dr. McGeeney, who is a neurologist, a certified headache specialist, and a pain management doctor, all rolled into one. And I have Dr. Kate Atkinson. She's my primary care physician. I have Dr. McCarthy, who is my psychiatrist. I have Brendan, who is my therapist. And I have Alex, who is my massage therapist. So those are sort of the 5 people who make up what I call my dream team. And they all sort of work with each other and talk to each other to help me increase my quality of life. Because as we know, at this time, there isn't a cure for migraine disease. And so what we work to do together, the 5 of them and me, is to increase my quality of life, increase the hours that I'm able to do things, and, try to get me to a point where I'm living and not just surviving, and where I'm thriving and not just living. Because I think that's what we all want. So those are the people that work with me on that. And it took me a long time and a lot of Terry Roberts' advice to get those people on my dream team. I had to go through a lot of doctors. I had to say, I'm worth it, and I need people who are going to work with me as a partner and that are going to fight for me. And I can say that all of the folks on the team have fought for me, have stood up for me, have, hugged me when I was crying sick in their offices. I mean, I am incredibly lucky to live in a state where I have access to those kind of doctors. And I realize I'm going a little bit stream of consciousness here, but I think you guys will probably follow me on this one. Is I feel like in my mind, if I was hearing somebody else say this, I would say, well, I bet she's got great insurance. I bet she's got really expensive insurance. And in fact, I am on the Massachusetts state health insurance, which is Medicaid, because my migraine attacks were so severe and so frequent that I became unable to work. It was about midway through college that they became incredibly severe. All of my professors told me to drop out, that I would never be able to hold on to a job, so why bother graduating? So I did take a few years off, and I worked as a preschool teacher for several years, and it was amazing. It's my favorite thing that I've ever done. It was always my life, and I hope to get back to it one day. But so I haven't been able to work, so I don't bring in income. So I'm eligible for what's called Mass Health, which is the government-funded insurance program in Massachusetts, and which is, you guys might know it under the umbrella of Medicaid. And so my insurance has been really helpful and in a lot of aspects, but it's not a fancy private insurance that I pay a lot of money for. So, but I was able to assemble these people to work with me. And it was amazing. And my parents were very helpful in understanding and accompanying me to appointments and things like that. And so, that's sort of how I ended up with Dr. McGeaney. And we were in Dr. McGeaney's office, and I said to him, look, I know that there's nothing else that can be done for me. I just want to figure out how to increase my quality of life a little bit, because the quality of life I have right now is not very good. And he just sort of stared at me, and he said, who told you that? And I named off a couple of doctors who told me that. And he said, there's never nothing else that can be done for you. That's never the case. He said, there's much to be done for you, and there's much that's coming down the pike. And so this was, 3 years ago. So it was, while sort of CGRP and stuff was in the back of our minds, but not really at the forefront of things yet. And I remember us leaving that appointment, and my parents were just tearing up. And I didn't understand what was happening. And they were just so grateful to him for giving hope back to our family and saying, there's other stuff we can try. We can go back and retry things. There's never not anything else you can do. And so, he gave hope back to us. And I feel like a lot of us in this community, we lose hope, and understandably so, because we're constantly in a lot of pain or feeling really sick, or there's a stigma that surrounds migraine. Our coworkers aren't always understanding. Our families aren't always understanding. And so to hear a doctor, especially a doctor who specialized in headache disorders like migraine, like cluster, say something like that was a huge turning point for me. And I knew when I started, when my attacks started to get really bad, I knew that I wanted to find a way to make my pain mean something. And so that's when I started to write about it, and that's when I sort of started to get involved in advocacy activities, because I felt like if I wrote something and then I had to spend the next week in bed or however much time in bed, that my writing and my thoughts would still be out there on the internet somewhere, and somebody could be helped by what I said, even if I'm throwing up in the bathroom, or even if I'm passed out on the bed in a dark room. The idea that I could still be helping someone while feeling so helpless at the same time was really important to me. So I invite anybody who wants to be involved with advocacy work to get involved. It's a really fulfilling way to process the kind of of pain and quite frankly trauma that some of us go through with these chronic invisible illnesses. So let me say, I'll tell you a little bit about the attacks themselves and a little bit about what I have used to treat them, and then we can start going into some questions. So the attacks themselves, and you'll notice I use specific terminology when I talk about migraine. I don't ever refer to migraine as a headache. If I'm having pain that's in my head, I will refer to it as head pain. For me, it's really important to say migraine attack, migraine disease, and head pain, things like that. And I really like to separate out the idea of headache, because you can have a migraine without having a headache. A headache is just one symptom of a migraine attack. So that's why you'll hear me keep saying head pain. So quick hello to everybody who's just joined. I'm Michelle Tracy. Some of you know me as the Migraine Warrior. Some of you know me as a moderator in the Move Against Migraine Facebook group that the American Migraine Foundation has created. And I've been talking a little bit about my migraine journey. Right now I'm going to talk a little bit about my migraine attacks and what I have used to treat them. And then we'll go into some questions from you guys. So a typical attack for me starts on the left side of my forehead. The head pain all radiates from right here. It'll go back over the top of my head, down into the base of my skull, by where, if you get occipital nerve blocks, that's where the pain will go, back down there, into my neck and into my shoulders. So that's the pain piece of it for me. I get extraordinarily nauseous. There are times when the nausea is actually greater than the head pain for me. Most of the time, they're about the same amount of severe. So nauseous that I vomit, that I can't keep down medication, that I can't keep down food, that I can't keep down fluids. I've had to be in the emergency room a number of times earlier on in my migraine career, I guess, if you want to call it that, because I had to get IV fluids. I had to get IV meds because I couldn't keep anything down. I get really dizzy. I get really sensitive to light and sound and smells. I get phantom smells, especially burnt things like burnt popcorn or burnt toast are things that show up a ton in my migraine attacks. I think I said busy already. I get, it's very difficult for me to sleep, not only because I'm in pain, but because I'm also just, I get really anxious. I deal with anxiety and depression anyway, and that intensifies during a migraine attack. And I'm trying to think of, I'm sure there are other things that I'm leaving out that I'm not thinking of right now, but it's bad. I can't get up and walk around. I can't drive places. I don't actually have lights in my room. Like, I don't have a clock. I've actually put tape over the air conditioner, which just lights up and says what the temperature is, because even that little bit of light is too much. And a light from an alarm clock, too much. I just can't do it. In terms of light sensitivity, I try to explain it to people in terms of what it's like when you come out of a movie theater at like 3 o'clock in the afternoon, and you've been in there for a long movie, like a Titanic long movie, and you walk straight outside, and that pain that hits your eyes. That's sort of how I explained it, because I used to explain it to my preschoolers, and I had to explain it a little bit differently to them so that they didn't get scared. And that was one of the ways that I explained it. And I actually have special sunglasses that I use during an attack or during when I go outside on sunny days and things like that, that are particularly tinted for people with migraines, and they're really very, very helpful. And just as I'm talking about my preschoolers for a minute, is that what we did with them was, a lot of times, and this might be helpful for those of you with kids or those of you who work with kids, a lot of time the kids learn through play. And so we had sort of a dramatic play area that I set up as an emergency room, and we sort of went through all of the things that happen at an ER, and they ended up playing ER doctor and learning a lot about migraines and medications and things like that. And it was really neat to see their compassion and their empathy for people like us. There was a little boy once. I have food triggers, one of which is chocolate, and there was a little boy once whose mom had gotten me chocolate for Christmas as a present, as a teacher present, and I opened it and he saw that it was chocolate. He was 7 years old. He saw that it was chocolate and he goes, "Mom, what are you trying to do? Kill her? She can't eat that." And then he very bravely said that he would eat the chocolate for me, which I thought was pretty cute and funny. And there was another little boy in that class, actually, whose mom dealt with migraines. And one day I came in and he was standing up on a shelf taping paper over the window. I was like, "What are you doing?" And he said, "We broke the shade yesterday, and I know the light bothers your eyes." So he was taping construction paper up on the window to help my eyes, to keep them from getting triggered, which I thought was really sweet. And I think they're a great example of how people who haven't been taught to stigmatize migraine or to disbelieve migraine can really be molded into advocates and really kind, compassionate people. And so that's a lot of what I did with my kiddos. And so, like I said, my attacks were really bad, and, and are really bad, and they were every day, and it was really severe. So I had to stop teaching. I just wasn't able to be there enough. And I lost a lot of friends, as I'm sure a lot of us have had trouble with social relationships, sometimes with family relationships. 3 of my closest friends, actually, I don't deal much with anymore because they couldn't handle the chronic and the severe nature of the migraine attacks. And so I don't have those folks in my life anymore. And I know that you guys all know what that feels like. So I just want to validate that experience for a second and say, if you've had that happen to you, you're not alone. I think most of us have had a falling out with somebody in our lives who didn't quite understand. And if you come away from anything tonight, from this, with anything tonight, it's that I want you to feel like there's somebody out there who understands what you're going through, and how difficult it is, because I don't think that we hear that enough. I don't think that we hear that, you're valuable and you're not broken and you're not a burden and you are worth good care and good health and respect and all sorts of things. I think that people forget to say that to us sometimes, and particularly I think they forget to say it to people who've been doing this a long time, who've been chronic for a long time. And so I just want you guys to know that everybody who's listening right now or who's listening in the future, please don't ever doubt that I believe you and I know that you are telling the truth, and your pain matters and your voice matters and your feelings are valid. And so that's what I want you to know from that piece. And so I'll talk really quickly about sort of what I take, and then we will move right into questions. So, and I'll try to be quick about this piece. So as I've told you, I deal with depression and anxiety, in addition to the migraine disease. The anxiety started when I was 13. The depression started about a year after I went chronic, so 19, 20 years old. So I've done dialectical behavior therapy for that piece, and I'll refer to it as DBT from here on out. but it's been a really amazing experience for me in terms of DBT. Taught me a lot of coping skills. It was actually recommended to me by a pain psychologist, and I thought, all right, I'll go and see what happens. And it was really helpful to me to learn how to process what was becoming my new normal, how to cope with living with a chronic disease that has a lot of stigma surrounding it, coping with the loss of my job, coping with, all different kinds of things. So dialectical behavior therapy is really an amazing tool. I know that Tammy Rome and Dawn Buse and Sharon Murray often say things about it as well. They're other prominent, amazing advocates in the migraine community. They're also my fellow moderators in Move Against Migraine, so we all have a lot of information about DBT. In terms of medication and other treatments, so just to right off the bat, yes, I've tried diet and lifestyle changes. I've done elimination diets. I've done food, figured out what my food triggers are, some of which are like aged cheeses, like Parmesan, Romano, things like that. Milk and dark chocolate have been triggers for me. Anything with nitrates like pork has been a trigger. MSG is a trigger. Artificial sweeteners, things like that. I know that a lot of you guys probably have similar triggers, and those aren't all of them, but so I avoid foods, or have at least avoided foods with those in them. I've been on Topamax, I've been on Depakote, I've been on all the blood pressure medications, different antidepressants. I've done Botox. I did 7 rounds of Botox, and I'm not having it anymore, but I'm happy to report that I can move my eyebrows up and down again. And I know some of you fellow Botox babes will understand the excitement of being able to move your eyebrows again. And I really, so I've done that. I do nerve blocks. I do occipitals, which is right at the base of your skull. I also do temporal nerve blocks, which is like when you bite down, the part of your head that pops out, that's where they block there. And then right here, I get what are called temporal nerve blocks. And basically that is just lidocaine inside a syringe. And those I find to be really helpful, particularly for the neck and shoulder pain that come with my attacks. And I have used, I use Relpax, which is elatriptan. That's the main triptan I use, but I've used all of them. And propranolol is sort of my daily medication, preventative medication. And then for attacks that sort of are stubborn and difficult, I'm lucky to live in the state of Massachusetts where medical and recreational marijuana are legal. So I do have my medical card, and I have used that. I do find it helpful, in particular for nausea and vomiting. And I've also used a ketamine nasal spray, which I know some of you've heard about Katie Golden, who gets ketamine infusions. Mine is a nasal spray. It's somewhat helpful. I have also recently started using Amivig, which is the new CGRP medication, and we're actually in the future going to do a Facebook Live just about Amivig in the very near future. I'm also working on a piece for the Association of Migraine Disorders with Dr. Rick Godley that's about my Amivig experience, because I wanted to make sure that I had all the information before I talked about it publicly. But I will say for now that it has been helpful for me. And so I look forward to telling you more about that soon.